everyone is getting the access to the medicine and the doctors. Our system is for the entire public. So our hospitals and clinics are in access to everyone.
One of the ways Belize has expanded access to health services is by changing its module for mental health care.
Belize has done several things to expand or to increase access to mental health services. Firstly, I think which they have done was to establish psychiatric clinics in all the districts. That immediately established community care, and people no longer had to travel to long distances to receive care. The second thing I think that was important was the closure of the mental institution. Third thing I think would be the mainstreaming of mental health care into primary health care, which provided access at all the primary health care facilities across the country.
Comparing how you had felt previously, not being able to sleep, but now you're able to sleep.
To increase the access to psychiatric services in the districts, the government decided to train registered nurses in psychiatric nursing, and those nurses were called psychiatric nurse practitioners.
When I see a client, whether it's the first time or follow-up, and the total work is done in terms of doing their mental status evaluation, the physical illness might appear, and they might have problem with their diabetes, problem with their hypertension, epigastric pain or so. I refer them to the medical officer, and vice versa too.
Now we don't have these patients coming so frequently with a diagnosis that has not been identified. Once we identify the problem, the mental problem, we deal with it. So this patient recover faster.
You cannot provide holistic care for someone if you're going to separate the body from the mind. So that's the first reason why we believe integrated care was necessary and important. Secondly, that patients now, or people who required care, were accessing care just like anybody else. So there was not that stigma attached to going to a mental health facility. Because that was mainstreamed, I think that now the stigma is reducing. And as such, now we have much more consultations for mental health services in the clinics.
We want to promote health, prevent disease, provide care, and where necessary, provide rehabilitation services, particularly without any financial distress to the patients.
My life had changed drastically because I had access to counseling. So I get free medication and I get free counseling. And I get access to a consumer group that is for patients to come together. If I didn't get the help, I could have been out there on the streets like so many are today.
Belize also established rehabilitation services in the community settings, providing follow-up care for patients with severe mental disorders.
The objective of this community treatment program that we do here in Belize is basically to go out in the community and treat the patients from the same community that they come from. Mental patients off the street, they would come here, and the purpose for them coming here is for them to take a shower, to have something to eat, and also to get their treatment. And after that, they leave again, so that they could be integrated back into the society as normal as possible.
Help me to calm down, balance my life. We have to relax more.
Coming here, doing this stuff, put time, it's a good idea. Make me feel good.
Access to services is limited for the rural population. Psychiatric nurses make home visits to patients who cannot afford to travel to a clinic or health center in the city.
Once a month, I come to the village to treat the patients. There are times when we have to come if there's a crisis with the patient, or if the patient has relapsed, or there are any changes within the family, and they come and report that something is happening there, we'll come.
Me comienza a dar un shock en la cabeza. Después vienen mis manos, comienzan a quedarse helados, mis manos, mis pies. Comienzo a oír voces que me hablan. Por eso ellos vienen a darme mi medicamento acá.
Once the patient is, the medication is there, the patient is with the family, they're able to function better.
Because the nurses were working in their districts, now we have people not having to travel long distances, sometimes hundreds of miles, to receive psychiatric care, which was centralized in Belize City.
No tengo que pensar de dinero para llevarla ni nada. Ellos me ayudan bastante, me la llevo al hospital, le hizo todo lo que le van a hacer y a mí mismo me la trajo acá.
Belize's restructuring of its mental health services has advanced considerably. The country now has a national mental health policy and budget and offers training for health professionals, but there are still challenges.
One of the basic needs is transportation.
I wish that we can have more of the nurses and the doctors that we can access them.
Despite all the problems that the country has been facing, the government has been able to provide access to healthcare to the population of Belize. I think it's remarkable the way that the mental health program has been integrated into the primary healthcare setting with an important community approach. The mental health program of Belize has been an inspiration for other countries in the Caribbean region.
The health system of Belize is much, much stronger now. You can see it with the number of patients coming to our hospitals, the amount of patients receiving access to medication, which is 2-3 times the amount. And that is how we can know that the health system in Belize has improved tremendously.